Just setting up to go live and then we can make a start. Thank you so much, everyone, for joining. Truly appreciate it. Please do me a favor, kindly invite somebody, share to someone, invite someone, let somebody know that we are online, and then they can also join. This is an awareness program. This is an awareness topic, and so we can all come together, support, share, and invite other people. So I'm just going to start with how I met my speaker. I've known her now exactly 15 years. I was just saying to her, in the days where, believe it or not, I used to be a children entertainer way back in the time. And I think our party she was my first client when I started. And she couldn't believe it that um, I'd never done it before. And obviously, the kids are now, I mean, they are big now. Then our son was 5 and our daughter was 3 years old. And I think since then, we just kind of kept in touch. I think we've done network marketing together as well. We've just kept in touch over the years. She's a fantastic woman. She's an early years practitioner. She's also a miracle consultant. And I always joke with her. I say that's why she's always looking prim and proper. As skin is always glowing. You know how when you see a miracle consultant, how they look. So yes, fantastic woman, like I said, very cheerful, very encouraging, very supportive. And I think one of the things that I like about you actually is how you're so detailed when you are putting people's birthday up on Facebook. I thought, I was detailed, but you are so detailed. I love the way you express when somebody is having a birthday. I read the write-up and I'm like, I think she does this intentionally. So keep it up. It's
Thank you.
beautiful to see. And I just want to say thank you so much for coming. She's also an author. She has written a book called Navigating Sickle Cell Disease. And this book is on Amazon. It's a parent's guide from a patient's perspective, offering heartfelt guidance and hope for parents of children with sickle cell disease, authored by herself, 52-year-old woman living with, and I'm trying to say SCD. The book shares a personal journey from diagnosis to living a full, resilient life. It emphasizes the importance of early diagnosis through newborn screening, proactive care, and building strong relationships with healthcare teams. Chinoye describes her experiences with pain crisis, complications, and treatments like now I have to take my glasses off. Sorry. I can't see when I'm reading. Like hydro
Hydrosis.
cereal. Okay.
Hydrosis.
Highlighting how modern advances have improved our quality of life. This guide also covers managing nutrition, hydration, emotionally um, encouraging parents to empower their children. It covers emotional well-being as well, and it also fosters resilience with a focus on faith, community, and education. This book reassures that with love, support, and proactive management, children with SCD can thrive and pursue their dreams. It concludes with resources and a message of hope for a brighter future. Thank you for writing that book. Thank you for putting it down, in simple terms for parents to read and also a guide also for people to follow. I think you're probably in my life, I've seen maybe about 5 people that I know who are close actually with sickle cell, and you're the second person actually that I've seen writing a book. It does help when I think people know. And I love the fact that, there are people here and there are people also who I want to say thank you also to Dr. Ola because literally I think it was 5 minutes to the program that I called you. Someone told me about you and you literally said to me that, this is something that you're really passionate about and you've jumped on board. Thank you so much for coming. I appreciate you. So I am going to just what would I do? Just replace the spotlight and invite Chinonye Agu. Thank you.
Hi everyone. Good evening. Good evening. Good evening. Thank you so much, Bumi, for inviting me to speak today. My name is Chinoye Azu. as Bumi said. And I work with children in the early years. I grew up in Nigeria. I moved to UK in 2004 to join my husband here. And we have two beautiful children, Daniel and Victoria. Daniel is 20 now, and Victoria is 18, off to uni September. And I just want to thank God for everything. It's not been easy, but like I always say, God has always been there for me. I grew up in a family of 8. At the moment, we are just 4 remaining. We lost 4, 3 to sickle cell. 1 was before me, but I didn't meet her anyway, but I know she passed on. So it's like sickle cell, I would say I haven't let it define me. Rather, when I got to know about my situation, I decided to follow every detail of what I was asked to do in order, I would say, to maybe live a long life. But with God, everything is possible, like I always say to people. And Bumi, thank you so much for inviting me to come and speak today, because this is something that is really very close to my heart. I like to talk about it and share with people around, just to create that awareness within our community. So today, I'll be discussing about sickle cell, the causes, how it can be diagnosed, symptoms, available treatment, and how you can manage your pain as well. I will also say that my journey hasn't been easy, but I've been trying to create awareness as well, so that people will know what this sickle cell is all about, because it's something that in UK alone, there's a lot of people with sickle cell. And if we don't create the awareness, people will not know what is going on. Living with this condition can be challenging, but with proper management and support, it is possible to lead a full life as well. So thank you so much for inviting me to speak today. I'll go. Is there some warriors in the house today? I would like to know as well. Sorry, just trying to.
I think you can just, if
Very
you're a
good.
warrior, you can just type Y in the chats, or you can use a reaction button.
Yeah. Okay. Let's go into it. What is sickle cell disease? Sickle cell disease is a genetic blood disorder passed down from parents. It is caused by mutation in the gene that codes for hemoglobin. That's the protein in red blood cells that helps carry oxygen. The normal red blood cells are round and flexible, but in sickle cell, they are shaped like crescents and sickles or sickles. These abnormal cells can stick together and block blood flow, leading to various health problems. It is most commonly among the people of African, Mediterranean, or Eastern region, or Indian ancestry as well. Like I said, I grew up in Nigeria, and I can remember vividly how I got to know that I had sickle cell. It was raining one evening like that. My parents went out, and me and my siblings were at home. So it was raining. I didn't know anything about being sickle cell, or if I'm sickle cell, I don't know anything about it. All I know is that it was raining. and I want to have fun. So we just ran outside to play in the rain, like young kids and everything, without knowing that there would be repercussion later on for me. So we all went outside, started playing in the rain. I enjoyed every bit of it. Then when my parents came back, they called us inside that we should come in and everything. So I changed, I had my shower and showered and went to bed. Late in the night, oh my goodness, pain. I don't even know how to say it. Like stabbing pains were all over my body. I was crying. I don't know what to do. My brothers, they were still young. I'm the eldest now because I have three brothers left with me. So we're just four left in the family now. But then I had a sister. She was still alive then. But like I said, it was a long time. I was still very young. I would say maybe we were just about two of us or three of us then, if I remember vividly what happened then. So, and I was having so much pain. I was crying. I don't know what to do. My parents was like, what's going on? What is happening? So I can't move my body. All my body was aching with serious pain. I haven't had that kind of pain before. I haven't experienced any of it. So my parents said, okay, let's start going to the hospital. We used to live close to University Teaching Hospital, Enugu in Nigeria. So we live close there. So they grabbed me, we started rushing. My dad doesn't drive anything, but we just started rushing because my house is not that, let me say maybe 10, 15 minutes walk to the hospital. So they took me, my brother carried me at his back, started going, we just ran to the hospital. On getting there, they asked what happened. With my parents say that they can't say, but they know that I complaining on all my body aching and everything. That I played outside. That it was raining. I went outside to play with my friends, with my brothers, and they said okay. First, they put the drip on me. They gave me painkiller. I can't remember the name now, but they gave me serious painkiller, and there, I was admitted that night. So they took some blood samples, said they would need to do some tests, to run some tests to find out what is going on or what is causing the pain I'm having. So that was how they got to know that after the result came out, they got to tell my parents that I'm SS, that I have sickle cell disease, and they talked to them and said that they need to get all the other ones tested to know if they have it as well. So they checked them, and most of my brothers, some of them are AS and everything. So I'm SS, my sister was SS, and the other one, but I lost my sister and my brother as well, like I said. So that was how I was diagnosed. But in recent times now, you can do the test immediately the child is born through newborn screening. And you don't, if a sickle cell patient is having pain, it's really, really a terrible pain. Sometimes you don't even know how to explain how the pain is. But I would say it's like a stabbing pain that all your joint, mine, when it comes, and it can come in various ways. Mine normally happens between my hand and my legs. Sometimes it can make me, I cannot even move from where I'm sitting when the pain starts. I cannot move because it's really an excruciating pain. So, and I'll go to the diagnosis, like I said. Sickle cell can be diagnosed through newborn screening tests, which are done shortly after birth. Blood tests such as hemoglobin, electrophoresis confirm the presence of abnormal hemoglobin. Sometimes a sickle cell trait carrying one copy of the gene is diagnosed, which is usually doesn't cause symptoms, but can be passed to children. Early diagnosis is always crucial for a sickle cell patient so that you can manage the pain effectively as well. And the gene, what I mean by talking about the gene is some people have AA, some people have AS, some people have SS. So when two parents like have AS, there's tendency they will have a sickle cell person from the family. So that's why, like now, my husband is an AA and my kids are AS. So even when they want to get married now, I will not advise them to get married to somebody that has SS, or I would prefer them getting married to someone that has AA in their blood. I'm sure Dr. Ola will chip in later because he will be able to explain that area very well as well, because I can't really say, but all I'm saying is that someone with ASAS, you can't go and marry someone with SS. It's a no area. You cannot do that. It's better to marry someone with AA. So it's always good to advise the children to test their genotype before they get married as well. That is what I would say in that area. Another thing is the symptoms for sickle cell. It can, like I said, sometimes you can have swelling of the feet, it can have jaundice, yellowing of the skin. The pain occurs so much that sometimes you don't even know where the pain is coming from. You can stay like this now, you're okay. The next minute, pain can come from anywhere. It's not that there's a lot of things that can trigger your pain, but you can't say when it's coming because it can just come unknown. You won't know that it's coming. You might just be healthy 1 minute. A sickle cell patient can be healthy 1 minute. The next minute, you hear that she's admitted in the hospital. That is how this crisis comes when it wants to come. So, but as time goes on, you know your body very well and you know what triggers your crisis, what can cause it as well. There's so many symptoms. Some of them have vision problems as well. It can occur. You can have really chronic anemia. Pain episode occur because sickle cell block the blood flow, causing tissue damage as well in the system. So to treat this, the treatment options there is no universal cure, but when you manage your symptoms, you can live a long life, like I said, a prolonged long life. You can live it by managing, knowing yourself, knowing how to manage your pain and manage your crisis when they arise. Like me, a changing game to me was the hydroxy. In it, when my doctor prescribed, they said I should go on the hydroxy, I didn't want to go on it because I wasn't sure. I don't know what it is about. So I told him that I don't want to go on it. So he said, okay, that's fine. But let me divert a bit. Before I came to the UK, before I was coming to the UK, I was afraid because I was like, it's a cold place. How am I gonna manage? How am I gonna cope? Because one, cold can trigger crisis. Extreme temperatures, even hotness can trigger crisis as well. So it depends. You have to know yourself very well to be able to manage your pain, to know when crisis coming, and then you can use your medication. Infection. as well can trigger crisis as well. So these are things that when you know yourself. So I was afraid when I was coming to the UK. I said, it's really a cold place. How am I going to cope and everything? Then another side of it was like, but here the health system is more improved than back home as well. So they should be able to manage my case. So I told my husband said, but here is better than Nigeria. So you will be fine. Came to UK. When I was back home, I often get crisis, but because from day one, after that incident of that rain, and I got to know about that sickle cell patient, I started looking after myself. Every medication that I have to take, I always make sure I take them. I forsake, but because I begin to learn my body to know when I'm going to be sick. Sometimes I won't end up in hospital, but sometimes I do, because sometimes you can't really avoid it. And you know, there's some people with sickle cell, like every 4 weeks, they have to go into hospital to take blood. I don't normally take blood. The only time I can remember being on blood transfusion was when I had my children. Then sometimes when I was back in Nigeria, I would say maybe 2 or 3 occasions. But there's some people living with this disease that has to go into hospital every 4 weeks to take blood, just to keep them going, just to keep them healthy and healthy. So every individual with sickle cell is different. Nobody's is the same with the other, if I put it that way. Every sickle cell patient you see, their crisis, their pain is different. Their case is different. But it all depends on individual, how you understand yourself, how you know yourself very well, to know that you have to really look after yourself. Because when you know yourself, then you can be able to know when you're tired, when you're fatigued, when you need to take a break from things that can cause you pain, that can trigger the crisis to come. So the pain management. So I'm going to just. It's a major component of sickle cell. Sorry, can you still hear? Yeah, okay. It's a major component of sickle cell disease, and managing it is very important. Strategies include medication, hydration, heat therapy, and relaxation techniques. It's important to have a pain management plan developed with your healthcare providers. Preventing crisis through regular medical check and avoiding triggers like dehydration, extreme cold, stress is essential. And support from your family and friends is very vital. And be in good terms with your healthcare practitioners as well. Because when I came into this country, I went into hospital. I think the first time I had crisis was when I was pregnant with my first baby. So I was rushed to A&E, and they still ran some tests because when they asked me, I said I'm a sickle cell patient, but they still did their own test as well to just make sure. Yeah. So because I remember back then in Nigeria, some people said that, I don't know, it was when I came here, they said that I don't really look like a sickle cell patient, because some of them, you see them immediately, you will know, because of the most times the yellowness of the skin, that's the jaundice, is really pronounced. You can see it easily. I'll say thank God. Sometimes you really need to look at me to notice it a bit. It's not that pronounced in me, but if you look very well, you might see it. But what I say to people, you see, water, you need to always, in all of us, we need to drink water. Water is good. But for a sickle cell patient, you need to drink at least 2 liters. I will say 2. But at least if you can drink up to more than 2 liters, it's good for you. Because one thing you don't want is to get dehydrated, and it will trigger your crisis immediately. And once you're rushing to hospital, drip first before they start any other thing. My pain medications, like I said, I used to be on cocodamol. Some people go on naproxen, but I don't like naproxen, because when they gave it to me, I didn't like the way it was. I felt within myself. So I told my doctor I don't want it. So, but I can go, once I go into hospital now, the first thing they will give me is Oramorph to subdue the pain I'm having, because that works for me. The morphine, it works for me, or the cocodamol. I use it. But cocodamol, sometimes what I notice, I take it, I might start itching. So most times now is that oral morph, the morphine I go on. So there's so many painkillers they can give you, but it's your body will tell them, you yourself, you know your body, you know what painkillers work well for you. And the nurses, most times they will ask you, the doctors, they will ask you, what do you prefer? What painkiller do you think works better for your pain? They will prescribe that and they will start on it with you. Though most times when you go to some, like the Queen Elizabeth, I know some of the sickle cell patients, they've complained as well that when they get there, the doctors, they leave them there. They don't see them immediately. And I told them, it happened to me, but once my doctors, they got to know me, once I get there now, what I do, I call my nurse practitioner. There's the hematology unit, I go there. There's a nurse that works with my doctor. So I'll give that lady a call, or I'll text her and say that I'm in A&E, and the next thing, he will now send message to my doctors. Before I know it, they will come to A&E. So that's the way I was working with them, because they have known me and I've known them. So they take it from there. So it's good to have good relationship as well with your health providers, because they are gonna be there. They are the ones that will be there when you need them. They will be able to help you and tell the doctors this patient has to go to, and then they will say, okay, just move her to this ward. They will move me to that hematology ward where my doctors can easily see me. I won't have to wait a long time in A&E before I'm seen. So it's good I tell people, it's good to have that relationship as well with your doctors and your nurses around, because they will always be there to support you. And what else can I say? The one incident, okay, I will tell you guys. One incident I had when I came to UK that I will not forget as well is when we went on a holiday trip. Maybe I'll say I didn't learn my lesson in Nigeria, so I want to try again here. I went to holiday with my kids and my husband. We went to Bognor Regis. I can't remember exactly how they owed there and when we went. You know, the children, there's all this water play there. So instead of me to respect myself, JJ, and just stay, the kids say, Mom, let's go have fun and everything. I said, okay, let me try. At least sometimes they say you can also do like swimming, that it helps sometimes with your pain. I don't know how to swim, but at least I can go into the water. I joined them and do all this water thing and everything. Behold, we went back to the hotel room in the night. Oh my God, I had another painful episode. And that was the day my kids saw me, because even each time I have crisis, I don't like them seeing me because one, I'm tearful, I'm in serious pain. I didn't really want them to see me like that. But it doesn't matter even if your kids see you like that, because that will make them know what you're going through as well. And they will be able to support you and help you as well. So that day they witnessed it firsthand that I was having serious pain. My husband, thank God we drove to Bucknell Ridges. My husband had to go and ask them, where is the nearest hospital? So they direct us. We got to the hospital. I was admitted. People that came for holiday. And this is our either second or third day into the holiday. We're meant to spend about 5 or 6 days there. I had to be admitted. I told my husband, don't bother, just take the kids and go back. As far as I'm in the hospital, I know I'll be fine. So they saw me, they asked about my care plan, what do I, everything, because this is a different place. Though it's still the same UK, but it's a different place. They don't know this. So I told them and everything. So they started with that, and gradually my pain started reducing. It was in 2000 and I would say 2 years now that I've been on hydroxy. But when my doctor told me, like I told you guys, told me about hydroxy, I didn't want to go on it because I didn't know what it is about. I was like, I wasn't, after he explained it, I didn't understand it. So I went back. I said, for now, I don't want anything. I know that because why my doctor decided to tell me again about it, I had another incident. And me, I never, ever since I started having sickle cell, I never have a chest pain or anything. All I have is that bone pain crisis, my hand, my leg, everywhere will be aching, my joints, all my body. So this time around, I had a pain in my chest, and it was so bad I had to be admitted in the hospital. When they ran tests, they found out I had pneumonia and I had infection as well. So it was really bad, that one, and my blood was going down, because when you're having crisis, your blood level goes down as well. So I stayed in the hospital this time, I think over 2 weeks, or because to be able to manage the infection and the pneumonia and I don't know if a sickle cell patient is here. When do you find difficult when they want to take blood from you, your veins? My vein play up a lot whenever I'm admitted in the hospital. Sometimes they have to go now call, the ones that the doctors, I don't know, Dr. Life, you can help me. Those doctors that specialize in, yes, they are the ones that will
Phlebotomist.
now come. Yes, they are the ones that will now come and check me to get my vein play up a lot. So every time I go to do because I see my doctors every 4 months or three. So each time I'm gonna go do blood, because I'm seeing them now on the 8th. So I'm gonna do my blood test before then. But before I go, I'll start praying that anybody that will do my blood, that want to take blood, that they have to see, because they poke me a lot, and sometimes I'll have bruises as well. So I don't like being sick, falling sick and everything. So I try as much as possible to manage my pain, look after myself, take my medication, anything that will send me to hospital. I try as much as possible to avoid it. But if it comes, then I know that's how God wanted it to happen at that time. So I'll just go with it. So this was how I was now. My doctor now said, you have to try this hydroxy. Even if you don't like it, then we'll stop it. So I said, okay. I went back. I said, okay, give me till my next appointment. Let me go through it. Let me read about it again. So I read it. I discussed with my husband. My husband said, let's try it now. Because for some time now, that period, I've had like crisis in between so many times. So he said, is this one now? Look, you spend almost 2 weeks in the hospital. So let's try it. They said if it's not good in your body, they will stop it. So what is there? There's no problem. So that after that, I went back to the hospital. I said, okay, let's try it and see how it is. So they started me with 2 of it, but now I'm on 3, and I told them that's where I don't want them to increase it anymore. So that some people, and since I went on that hydroxy, I haven't had crisis. I'll tell you the truth. I haven't had crisis for almost 2 years now. I haven't had a crisis. Even if I feel any pain, it's something I can manage. I'll just take a painkiller but like going into hospital, I haven't gone into hospital for good 2 years now, which is, I thank God for that. Because I know people that has constant crisis pain, which is very, very painful. So it's something that I just thank God for myself and for every warrior that is here that is battling pain and everything. Just know that you can you still hear me, please? That,
Yes, yes, we
okay,
can.
sorry, let me just, I have to drink that one. When I talk a lot, my throat start getting dry. So just know that you can manage your crisis. As far as you're doing the right thing, you're taking your medications and everything, you can do everything. So hydroxy is a good one. If your doctor recommends it, try and go on it and see how it feels on your body. Even if you don't like it, you can still stop. You can say, I don't want to go on it. But I tell people, try it. If it doesn't work for you, you stop it. It's not every medication that will work for A that will work for B. So it's your body, you know your body, and if it's good for you, then be on it. It doesn't matter. It's good that you find something that is relieving your pain, that is making you, that is stopping you from having frequent crises. I will say, put it like that. So the possible complications is that sickle cell disease can lead to serious complications such as stroke, organ damage, delayed growth, leg ulcers, or increased risk of infection as well. So it's good to be monitoring it. So that is okay, I'll look at that later. Regular monitoring and preventive care are necessary to catch and treat complication early. Because if you're going to your checkups, and don't miss your checkups, just go for it. Even if you're feeling 100%, just still go for those checkups. It's good. Because so your doctors, they will still run those blood tests to know your blood level is where it's supposed to be, that is good. And if you have any pain, you can complain that day. They can give you something that will help you to manage your pain at home. Don't wait till you're fall sick for you to go and see your doctors. Those regular, it helps a lot. You need to keep up with it and go for those checkups. I don't miss my checkups. Unless something happen, and I'll still call them and say, can you move my appointment because I can't make it on this day. So I don't miss my checkup for anything. Even now that I haven't had crisis for a while, for a long time now, I still go for those checkups because it's really good. It will help you as well. So that is that. And there's something else. say, I would say how I've been coping as well with my sickle cell is, like I say, by not missing my medication, sticking to my routines, those things that will trigger my crisis, I try to avoid it as much as possible. At work, let your employer know that you are a sickle cell patient. Don't keep it to yourself. At school, if it is your child, tell them my child is a sickle cell. It's not something that you have to shy away from or just you don't want to talk about it. You need to talk about it because when you talk about it, that's when, if there's anything, people will be able to know how to help you or how to look after your child. At work, I told them this. So they know that when it's very, very cold, I can't stay outside with the children. I will swap with somebody and I will go inside. Because with early years, you have to constantly be outdoors with the children. But they know that when it's really cold like that, I cannot stay outside. So I have to go in. But if I didn't tell them, I'm like, oh, shying away, I don't want to say anything about it. I don't want anybody to know that I'm a sickle cell, this, that. Then when you now start saying it, they will ask you, from day one, you didn't even tell us about this or anything. So there's risk assessment for everything at work. Most times, like I work in toddler room, most times you're meant to like sit on the floor. But because sometimes I have like hip pain sometimes, though it's getting better, I have a chair I sit on. I don't go down on the floor like that. And even if I go, I know that I have to get up easily to quickly, not to stay there for long because it's gonna affect me. So these are little things that you need to tell your boss or whoever employed you to work. And they will know. And they will know how to support you. So it's as well when your child is in school, if she or he is a sickle cell, you still let the school know because they might do sports day and they might not know. And a child with sickle cell, when you run too much as well or do sports, you're easily worn out, you're easily tired. You can even faint. So things like this can trigger crisis as well. So you need to let them know. They need to be aware of those things and things that can cause you crisis, that can cause you pain. They need to be aware. So these are things that I've been doing. Even when I was back home, and when I used to be so much sick in school, then some people say this Obanje girl, I don't know how to translate it in English, people that are here. They call me so many names. But I didn't let sickle cell define me. I didn't let it make me to start feeling bad about myself because I know that I am fearfully and wonderfully made. I am blessed and highly favored at all times. So, and I know that God that created me has a purpose for me. So when I knew everything about sickle cell, when I was diagnosed, as I was growing up, I was trying to know more about the sickle cell thing. And that was how I kept looking after myself, managing my sickle cell and everything. Like before I met my husband in school. From day one, I told him I'm a sickle cell patient. I have SS. You need to tell me your blood this thing before we can continue anything. He looked at me. He was like, I said, yes. It's either yes or no. It's either you tell me if you're AA, then we can date if you want to date. But if you don't want to, that because I'm SS, that's fine. So I didn't like start hiding it. I make it known from day one so that if it's something we have to go about, fine, we'll go about it. If it's not. So he told me he's AA, but he will still confirm with the mom to find out. So he asked the mom said, yes, you're AA. Why are you asking? He said, don't worry. So it was later he was now explaining to me. So, but later he still told mom, look, why he asked. So the mom said, yeah, that it's fine. So it's better that you make people aware of your problem so that if they can help you, they can help you. If they can support you, they will support you. But if you're not telling people, they will not know. And even if you tell them, if they want to judge you, that's their own business. It doesn't concern you. So make your problem known to people. I know that, yeah, sometimes we want to hide, but with sickle cell, it's not something you can just hide like that, though, because supposing you go somewhere and something happens, start happening to you. If people around there, they don't know you and they're not aware of your situation, what will happen? So these are things that you think about before you say, oh, I want to hide or I don't want to hide. What else? I drink a lot. Even at work, they know me. Once I drink as well, I want to go away. But my water, I have to drink because I know that if I don't drink, I get dehydrated, I land in the hospital. So even when I don't feel like drinking, I have to force myself to drink because I know I need it. And I have to make sure I drink up to that 2 liters or over it to be safe and to be well. Eat nutritious food, do exercise, but know your body to know the kind of exercise you do. Don't do too much strenuous things that will trigger your crisis as well. What else? And during cold weather, keep yourself warm, but don't be too hot as well because too hot can still trigger crisis. So you just have to balance it up and know what works for you, how your body works, and know yourself. Then you can be able to manage yourself as well. Take your medications, rest when you need rest. Don't overdo things or you want to do this. And when you need break, just take that break because that's your body telling you you need to slow down now. So try and rest as well. Also, okay. I'll say that my message to all warriors here is do not let sickle cell define you. Do not let anyone define you either. It's the word of God that created you, it's the word of God that defines you. I want you to remember this. Your strength is incredible. Every day you face challenge with courage and resilience that inspire others. You are not alone. Your fight is powerful and your spirit shine brightly. Even in difficult times, keep hope alive. Believe in your inner strength. You are a warrior and your resilience makes you unstoppable. You are strong and brave. Living with sickle cell can be tough, but with right care, support, and attitude, you can live a full and active life. Remember to take your medication and follow your doctor's advice. Stay hydrated, eat healthy, and avoid extreme temperature. Watch for symptoms and seek help early. Don't be afraid, like I said, to ask for support from your friends, family, and your healthcare providers. Keep a positive mindset and believe in your inner strength. You are not alone. There is a community of warriors out there, and together we can face anything. Thank you so much. I hope I'm able to share with you what sickle cell is. And if there's any questions that you want to ask me, I'll take them. And if I don't know, we have a doctor in the house that can help and support me here. Thank you so much.
Thank you so much, sis. Thank you so much. Please, can you
Thank
give
you.
her a reaction button? Just say thank you, thank you, thank you. Thank you for sharing your experience. Thank you for sharing a part of you. Thank you for taking it back for us. I know sometimes with the little that you've shared, it could have triggered, some of some emotions in you as well. So we really do appreciate you. The bit of
Thank
questions
you.
for you, but I'm not going to go into the questions yet.
Yeah.
I'm going to invite Dr. Ola as well to just share, and then we'll go into
Yes,
the
please.
questions, yeah, alongside with you all. Yes, please, Dr. Ola, thank you so much.
Thank you very much. Can
Thank
you hear
you.
me?
Yes, we
Yes.
can.
I'm very honored and happy to be here with you, even though it's a short notice, but you can call me to speak about because of sickle cell in 1 second and I'll have something to say. What I
Thank
want to
you.
say, what I want to say, I don't want to say so much, but what I want to say is that the red cells in the abnormal red cells in patients who have sickle cell, they only live for 30 to 40 days, while the normal cells lives for 120 days. You see, there's always a deficit. That's why they have low energy levels.
Yeah.
And then those sickle cells, they have this ability of clumping together. They join
Yeah.
up together and block small blood vessels. That's when the area beyond the blockage does not have oxygen or nutrients, then it results in pain. That is what we call crisis.
Yes.
Those are the two things. Then one ask I want to ask from everybody is this is 2025. With the level of knowledge we have, we should not be bringing SS patients into the world again. The ones that are available, people like us who are passionate and everybody, we give them the support, we do all we can to help them. But we should not bring this type of children in. Why would you do that to your child? Bring a child into the world that has to deal with pain every single day of their lives. We should do
Exactly.
everything to avoid it. In this country, 300 children are born every year with sickle cell. On the NHS register, we have 17,500 people living with sickle cell. We can reduce the number, we can eradicate it. Please, let's do, everybody should know your genotype. If you're born in this country, it's in your file. Go, just you need to ask your GP. If you were not born in this country, if you are born in Nigeria, which is the sickle cell capital of the world, 25% of the yes, 25% of the global load of sickle cell is in Nigeria.
Yeah.
That's why that yes, everybody knows everybody, either a friend or a school or something. It's not Ogbanje, it's not Abiku, it's just a gene mutation. It's an
That's
illness
right.
like headache or malaria or anything, which needs to be given adequate attention and support. My goal is that every child who is born, if you have it in your, if you there's S on any side of your family, or you happen to have the trait, by the age of 9 or 10, every child should be able to know that I have this trait. I'm not suffering. I'm not an SS patient, but I'm AS or SC or I'm a carrier. And I have
Mm.
the ability to transfer it to my offspring. Therefore, I
Mm-hmm.
should not procreate with another carrier. If I procreate with another carrier, we will bring this problem to the fore. Let anybody who has an AS child or there's S trait in your family, let the children know from the age of 7, 8, 10, they grow up with it. So that when they start
Yeah.
becoming friendly with anybody, that's the first thing they would ask. So that they will not have this. Look at my sister. Kudos to you, dear warrior. I call you champion.
Thank you.
You're a
Thank you.
champion. Look
Thank
at
you,
what
ma.
she's going through every day. Why would you? Nobody will see a pit or a mine and intentionally jump into it. I believe that people who are saying love is not, they don't really know. They should talk to
No.
people who have experienced it. Or the reason why I know
Exactly.
this is that in the 1991, I was the doctor in charge of the hematology daycare. I took care of children living with sickle cell anemia. So I have first-hand experience. I owe the blood bank 40 units of blood. I've never been transfused. I just sign my
Wow.
name for patients who, when the patient is about to die just because of blood, I say, put my name. The patient, I cannot allow somebody to die. And when they get well, they go away, they don't come back and pay. It's my name that is there. But
Mm.
because I was the boss, they
It's
couldn't hold
something
me.
you were
I don't
doing.
care. People steal money to go to give to girlfriend or go to Dubai. I use blood to save life. I didn't do anything evil. So what I'm trying to say is that we should work hard not to bring more SS patients into the world. And if you have the
Exactly.
ability and you are not a champion and you are not a warrior, please donate blood. Those are the two ways you can help. Support, if you know what triggers crisis, you know everything. If your neighbor is having something, you'll be able to help. So don't say, I'm not SS, I don't need the knowledge. We all need this awareness. That's one of the things I
Exactly.
go around doing. Give awareness. Let everybody know about it. And
Yeah.
if you don't know your genotype, go check. If you are born in Nigeria and you don't know it, and you don't have 120 pounds to go and do it private, go to NHS and volunteer to donate blood. If you volunteer that you want to donate blood, they will do all the tests for you free of charge. Then you'll be able to know, and then you can give blood, or you may not give blood, or you may be fit, or you may not, because they don't bleed you if you are not fit. But at least
Yeah.
you would know your status without pain if you offer to volunteer. But if you can donate, I plead with you, please give us blood. We need it.
Exactly. We need it.
We
So
need it. We need it. Because some people, they need blood transfusions every month to live a normal life.
yes.
Some every 3 months. Some don't have
Yeah.
so much crisis. Some have bone marrow transplant, all kinds of
Mm-hmm.
things, stem
Mm-hmm.
cell, and this and the other. There are different treatment
Yeah.
modalities are available. But as she said, not everybody is fit for everything. Even this our wonder drug hydroxyurea, it doesn't work for some people. But when it works
Yes.
for you, it's like magic. Those people that it works for, it works very well. Some people, it doesn't work for them. The reason is that it works like, you see, this S gene is recessive. When there is
Yeah.
another gene that is stronger, it doesn't act at all. So the
Oh.
hydroxyurea works like as if there's another gene suppressing the S. So those who have hemoglobin F, what we call hemoglobin F, hydroxyurea doesn't work for them, but they don't have a lot of crisis.
Okay.
It's people who have frequent crises that require hydroxyurea. And this is a living testimony. If somebody says, I was falling sick frequently, I've been on a drug, and for 2 years I've not gone on admission, what other testimony do you need? It works for those whom
It
it works for.
does.
If it works for you, try. It's good if you have
Yeah.
something that will prevent. Who wants to be going to the hospital every time? It's traumatic for everybody, the family, the husband, the relative, the children, everybody. They will go and visit. So if we can avoid it, let's do something that can avoid it. But the two asks that I am asking: know your genotype.
Yeah. It's
Love is
very
not blind.
important.
Know your genotype. And if you are a carrier, you are carrying the trait, please don't procreate with another carrier, because you will produce, and you have the
SS.
um yes, you have the chance of producing an SS. We don't want more SS. We want to take care of the ones that are here, help them, support them, but we don't want to bring more into the world. And if you can donate blood, please do. I saw somebody donated placenta for stem cell. God bless you. So if you can do any
Um,
donation that can help to make their life better, it's not their fault. That's the way they were born. They didn't ask for it.
yeah.
So we should give them all the support that we can. Thank you very much.
Thank you so much,
I'm
Doctor.
ready to
I
take
appreciate
questions
that.
now.
Thank you so much. Thank you, thank you, thank you. So we've got some questions. And like I love what Dr. Ola said and what Sister Noye also said. I believe that back in the days, our parents didn't know, they didn't have the education, they didn't have the
Yeah.
knowledge that we have now. So it's very, very, very important that we know our genotype and also to be able to even know the people around you as well so that you can support them, so that you can help them. Um,
Mm.
Water is good. I'm just trying to find out what the question is. I'm trying to read now. Okay, yes. So the first question was this age medicine or drug that you've mentioned, is it available in Nigeria? Somebody has asked.
Yes, it is
Oh,
available in
okay.
Nigeria.
Okay.
Available all over the world.
Okay. So
Okay.
for whoever that person is, Sister Chino, maybe you can type the name of the medicine.
Okay.
Yeah,
Yeah.
you can put it
Hydroxyurea.
in the chat
Okay.
here.
Yeah.
Because I know
Okay.
that person has a warrior in their family, so I think it's
Okay.
very, very
All right.
important. Then somebody also asked, maybe this person wasn't there when we first started. How is sickle cell birth?
How is it?
Birth, how does it come
Oh, okay.
into, yeah.
Sickle
No, I think
cell.
she means when you're giving birth as a person with sickle cell. How was it to give birth?
Okay.
Oh, okay.
I'm when I was pregnant, like I said, I had about, I think twice I had crisis. But I wasn't all that ill, frequent ill when I was pregnant, of which I was surprised as well. So, then I was meant to have my bed naturally, but as my son's, I want to, on getting to the hospital, I was dilating, but they found out that my son's breathing, or I don't know how to say, was going down kind of. So they had to do emergency cesarean for me as for that. So, but both of them, I had them through CS anyway. And I think, Daniel, after that, I had blood transfusion because my blood level went down. For Victoria, I think I was fine. I didn't have any blood transfusion after the surgery. So they gave me pain epidural for me to be able to manage my pain through CS. So that was how I gave birth. But I'm sure some of them, I think somebody has had natural birth as well, being
Yeah.
sickle cell. So it works, it can go both ways.
Yes, because I've had a friend who's had natural, and yeah, it can
Yeah,
go both
so
ways. For
mm,
every for different children. But please, can I beg
mm.
everyone here, if you have not registered for blood donation, please, I'm
I'm gonna
begging you,
find the name
go
and
and
type it.
register. I think it's a good thing. Um, I mean, I think I listened to this kind of thing so many years ago, and honestly, since then, I just had to go and you just do it. There's a lot of people out there that need blood, and one day they may call on you to come and donate, but please do donate blood. And going to the blood question, someone says, "What age are you not able to donate blood?" Or is it what age are you able to, or what age? Well, it's what age are you not able to donate blood?
Doctor, I hope I'm right with that spelling.
Yes, that's it, hydroxyurea,
Okay.
yes.
Yeah.
So someone says, what age are you not able to donate blood?
Well, I would say that maybe from 65 or thereabouts, but it's not the age that is the most important thing. When you register for blood donation, you are going to be screened and tested. If you are not fit, your blood will not be taken. Because I have some people who donate for my charity in Nigeria. I have a guy, he's 65, he still donates.
Wow.
Even when I want to give him malt or to say thank you, we will say you are using it for charity. I'm not donating for you. They said at our age we should not take malt and sugary things. Keep your malt. I don't want it. I'm saving life
Oh,
with my
bless
blood.
him.
Yeah, yeah,
Bless
yeah.
him.
I get voluntary donors so that we can give blood transfusion free of charge to those who need.
Yeah, it's very important,
Yes.
honestly. That blood
So
is
it's
very
not the age that
important.
is important, it's your fitness because you are going to be screened before you are asked to donate blood. Once you volunteer to donate blood or you get to the blood bank, your blood will be checked. It will be properly screened before
Mm.
you are bled. And if you are not fit, your blood will not be taken.
Thank you so much. There is a link in the chat for blood donation for registration. So you can just click on it. It takes few minutes, seconds to just put in your details and just do it, like Tesco would say. The next question. In Nigeria, I used to donate for women from my experience is better before period or 2 weeks after period. Is that good? I'm not sure, Dr. Ola.
Yes.
Mm.
Yes, 2 weeks after period because you lose blood during the period and your PCV goes down. So you have to wait to build it up. Though it takes 5 days. It takes 5 days for your bone marrow to build out new red cells, but 2 weeks you would have come back to optima.
Thank you so much. Any other question? Or if somebody maybe wants to share of their own experience as well, if
Yes,
you've been with a
please.
warrior, you are a warrior, I think it's a good platform. You can just use the reaction button and just share. Anyone wants to share? Don't worry, you don't have to show your face if you don't want to.
Mhm.
If someone says, please, can SS patients donate blood?
No, sir.
No, no.
I have told you that their red cells don't live long enough. They are in a constant state of deficit. So they
Yeah.
should keep what they have. If they donate blood, it will trigger crisis.
Okay. Thank you so much. Yes, please.
Please, where is
Babasiton,
Dr.
yes.
Ola based? Is she based in the UK or Nigeria?
Right now, I'm in London, but I practiced in Nigeria until I retired. And I'm still running a charity in Nigeria for people living with sickle cell anemia.
Okay, can we have details of your charity?
Yeah, I'll
Oh,
send it. I'll send it
okay.
here.
Okay,
That's fine.
fantastic.
Yeah,
Thank you very
Okay.
much.
send it. Yes, please. I saw a hand raised. Yes, go on.
Well, I want to make two comments. One, for people who may have been tested in Nigeria, there's a lot of people that say they've been tested and they were told they were AA, only to get married to someone and then they find the kid is SS. So if it's possible, please test in reliable places and maybe test in more than one place to make sure you get the
Sorry.
right test.
Okay, please let me add one thing to that. From my experience, I told you I've been in sickle cell since 1991. From my experience, 99.9% of the people who have mistakes or they've given the wrong genotype are men. I do not understand. I do not understand why it is, because the woman, when I'm counseling, the woman will say, I am sure sickle is in my family and I cannot afford to do that. And I did my test, but they made a mistake with my husband's own. So I'm appealing to the men. I'm appealing to the men not to allow them to make a mistake with yours. I'm not making any assumptions, but I'm just telling the men, why is it, I cannot figure out, is it the Y chromosome, or is it that they didn't do it, or is it that something that blocks it on their side? I don't know, because I don't want to assume. All I'm saying that if you are in Nigeria and you want to check your genotype, check it in a reliable place or a government hospital and go to a second place. Don't, if there is S in your family, don't be satisfied with checking once. And there are also many reasons why there can be wrong result. Some people don't know how to read the electrophoresis. They make a mistake. Some people use expired reagents and it won't work well because it's subjective. Somebody has to read the separation of the cells on the electrophoresis machine. It's an individual. The individual can make a mistake. So if you know that you are AS or there's somebody in your family or something and you're checking, you have to check and double check. Go to a government hospital or a teaching hospital and check and double check, because the trouble that comes with not checking is too much.
It's too much.
The trouble is
too
much.
much.
You cannot afford to take it for granted. When
I'm
I say to people,
telling
I said, will you cross the dual carriageway, the road, and close your eyes and say, I have faith? You would never do
No.
that. You will use your common sense and be careful. The same thing with
Mm.
things like sickle cell. Keep your eyes open. Love should not be blind here. You should
At
wear
all.
contact lens. Open, shine your eye, wear contact lens, do the right thing. And then we will reduce the number of SS and we will have this less mistake of, they said, I'm not sure. I'm not saying that labs don't make mistakes. Mistakes can be made anywhere. It is more in Nigeria because we are a third world country. I'm not doubting that, but the individuals affected, do yourself a favor, check and recheck. You don't have to come to the UK to recheck. There are teaching hospitals in Nigeria. There are even some private hospitals who are good. Talk to your doctor. If somebody is close to you or your cousin or a carrier or something, then you have the responsibility of checking and rechecking.
Mm.
Thank
Thank
you.
you so much.
Thank you. The second thing I wanted to mention, Dr. Ola, please, could you just enlighten the audience about SC? Everybody talks about AS, SS, AA, but hardly do people talk about SC. So they need to realize that once the S is there, caution, brake light,
Thank
brake
you.
light, brake light.
Thank you. Thank you. SC is a champion too, a warrior. SC is a sickler. Yes, it's just that in the bottom rung of the ladder is SS. SS is the worst type of sickle. CC is next. SC is next, and then CC. There's CC, there's SC. But those with SC and CC, because they don't have two S's, their crises are not severe, and they don't take their medications regularly. They're not as cautious, and those with SS. But during pregnancy for the women, that is when you will now realize that SC is a sickler too, because the stress of pregnancy weighs so much on their system, and they begin to have all the symptoms they were not having when they were not pregnant. So SC is a sickle cell patient, SS is a sickle cell patient, CC is a sickle cell patient. They are all abnormal hemoglobins. It's the A that is the normal hemoglobin. But the severity of the illness, that's the difference. SS is the worst. SC, they don't fall sick so much, but they still have those bone pain crises if they expose themselves to the trigger factors, as our dear sister just mentioned. She has mentioned most of the trigger factors.
Thank you.
Thank you so much.
And then, sorry, there's one that she didn't mention. Let me mention it now.
AC.
High altitude, where there is low oxygen tension, can
Okay.
trigger crisis. So SS should not go mountain climbing or doing all those things where you don't have enough oxygen. It will trigger a crisis.
Okay.
Thank you.
And now that you mentioned high
Thank you so
altitude,
much.
are there any precautions when people living with sickle cell are flying, especially long flights? I just want that for us to share that with the audience.
Okay.
What I do, like when I'm in the aircraft as well, because I don't sit for long, I always make sure to walk the aisle as well, because if you sit for long, I think sometimes it causes, is it blood clots? I'm not sure now, Dr. Ola, but it's tendency you might have crisis as well. If you sit for long, you're not exercising, like it's a 6-hour flight. Some people don't like moving from their chair. They just want to sit there, but I encourage, like a sickler, just to move around from time to time, just to walk around so that you like have air or something. I don't know how to describe it, but I don't sit for long like that in the aircraft.
I just want to add something to that. Because the sickle cells have the property of sticking together and blocking blood vessels,
Yes,
you need
sir.
to take water too.
Yes.
That's why you take
That
water
one,
and keep
that
them
one I
separated. So
drink a lot.
if you're
Yes.
traveling for long, you take water, you go to the bathroom, you move. That helps you. Because you're in the plane, you have enough. It's high altitude, but it should not be too long.
Yeah.
Because if it is too long, it could trigger a crisis, but you have to be careful. You drink lots of water, you ambulate, you move around. When you move around, your blood flow is better. And then you can wear compression socks.
Socks, yeah.
So that you don't have
Yeah.
clots in your calf. Things like that would help when you have air travel.
Yeah.
And also keeping warm, because sometimes it can be cold in the plane.
Cold.
Oh, yes.
Yeah.
Extremes of
Definitely.
temperature trigger crisis. Whether it's too cold or too hot, you have crisis.
Yeah.
So you have to dress well. That doesn't have to do with plane. Whether it's winter or any, you must keep warm.
Yeah.
Thank you so much. Thank you,
You're
sis,
welcome.
also for asking those questions. So I've got same person asking this question, it's kind of related. Doctor, why are some patients SS have ulcers? Doctor, I'm 62 years old now. I was born in the UK. I went back to Nigeria. I did my schooling in Nigeria. I came to the UK and I started to have leg ulcers.
Oh.
Okay. Leg ulcers are due to the same reason I said, the same reason for crisis, poor oxygen flow to that area. Because once the cells clump up together and they block the small vessel and there's no oxygen, there's no blood supply, there's no nutrients, the cells after that blockage, they die off. And then it becomes an ulcer. And you know that the foot is the dependent part for the blood to return. If the blood does not return very well or we are not ambulating very well, the leg ulcers occur. And they can be chronic. I have a particular one in my club now. We have done everything. We have grafted him. He still broke down. We did compression dressing. It will heal. After some months, it will go back and break down again. So it's a difficult thing to manage. It's better prevented. That's why we talk about compression socks. Just know your body and do the things that will not predispose to. If you sit for long, it's not healthy to do a sedentary job, sit in the same place, and you sit down, the venous drainage return from your ankles is poor. You have to move around. You have to drink a lot of water and you have to eat healthy. For example, in my charity, I give them eggs because there's poverty in our land and people with sickle cell don't eat well. If you don't eat well, your wound will not heal. So it is one of the complications of sickle cell. Some have even what we call avascular necrosis of the head of femur. You know, they walk like with that kind of gait because the head of the femur has collapsed. The head of the femur has only one artery supplying blood to it. If that artery is blocked by sickle cells and blood does not get to that ball, you know, it's a ball and socket joint. There's no blood supply to that ball. The bone dies and it crushes. Once it dies, it collapses and the ball and socket joint is ruined. And that's why they walk like that. So it's that kind of thing that also causes the leg ulcers.
Thank you so much. Thank you. Okay, while we're waiting on Dr. La, someone says, and this is a good advice because everything she's saying, I'm just saying to myself, if we know all of this, like she said, this is 2025, we must try so much, not to bring sickle cell children into the world. This is a lot to take in, honestly speaking. And so someone says, I always tell single people. So maybe it's not just our telling single people. Let's make it our responsibility to educate single people that on your first day, especially if you're a carrier, the first question should be your genotype and your blood group. Ask this question, please, before you order food. She's putting a laughing emoji. It looks like it's a laughing thing, but it's actually a very serious thing. It is a very serious discussion that we ask, that we educate people around us to please ask these questions, that it's important so that, when they love first, it's quite difficult to pull them. But once they ask these questions first and they understand the reason why, then it's easier for them to understand what they're going to put in or what they're going to take away from it. So that is the question. I think, yes, since you can answer this question, we're waiting on doctor to come back. What advice would you give to spouses and parents who are living with people who have sickle cell? I was about to ask that question, actually. So it's more of support.
Like what I said, you just have to be there for them because one, they didn't bring themselves into the world and it has already happened. So take it with good faith, be there for them, and whatever they have been told to do, follow the routines. Like your medication, you have to stick to it. Avoid what you have to avoid. Those things that can trigger crisis, stay away from them. Anything that will cause you pain, you don't need to go and say, oh, let me try first to know if it will trigger or not. Just try and avoid them. Water, like I said, you have to constantly drink water. Even if you don't feel like drinking it, you have to make it a habit. It's mandatory. It's something you have to drink. Drink more of water instead of juice, Coke, or any other thing. Drink more of water because it is what will help you. Then extreme temperatures can trigger crisis. So know your body, know your child, work together to find balance on how you can support your child and how to go about everything. Don't miss appointments, your checkups, whether you're having that crisis or whether you're not having those crises. Go for your regular checkup. It's always good. It will help you. These are things that have carried me on till this age I am now. And I know that I'll still live long because God has already been there for me and He will always continue to guide me, direct me. And so I believe that every child can thrive, every child can still be anything they want to be, whether you're sickle cell or not. You can still become what you want to be. As far as you're doing those things that you're supposed to do, that will help you to prolong your life, that will help you stay, just avoid those things that you have to avoid. Stay away from them. Then you can live a good life. You can be anything you want to become. That's all I will say.
Thank you so much. And maybe also pass those things down to the children, because
Yes.
as the child is growing up, they need to also understand
No.
these
Yeah.
things. Yeah, I think it's important. Thank you so much. Doctor, but I'm being suggested for a 90-50 blood transfusion because it seems that monthly blood transfusion is no more effective. I'm not sure. Is that a question? Is that a statement? Okay. Um,
That is from the previous person who was asking about ulcers.
okay.
Okay.
Thank you. Okay.
Yes.
It's regarding the leg ulcer. So this person is saying that they've been suggested for a 50-50 blood transfusion because it seems that monthly blood transfusion is no more effective.
Is that a question?
Yeah, I'm not sure as well. If the person is here, you can just unmute yourself if it's a question so that you can ask.
And if you don't want to
Also,
show your face, you can type
yeah,
the question.
you can type it.
Type the
Okay,
question if you don't want to show your face.
you can unmute yourself. Let me look for you actually. You can unmute yourself and just ask.
I've asked the person to unmute.
Okay,
Yeah,
thank you.
I'm coming. Yeah, let me the lights. Are you seeing me now?
Oh, you can
Okay.
just talk. Don't worry. Just talk. That's fine.
I don't know what's happening. Yeah,
We can hear you.
yeah. Good evening, all.
Good
Good evening.
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 Yeah, like as the question follows. When I'm having these regular ulcers, I started having this ulcer in 2018.
Okay.
And every time I have this ulcer, because I don't know that this ulcer will come to me. I started traveling. I came to back to London in 2015. Then 2016, 2017, I started we have expressing this ulcer. And when I have it, I will they will tell me I should come back, home. It is a new late, all those things that are happening down. And my doctor, an Indian lady, will tell me, actually, it's not that. It's according to it's a sickle cell things defined in seculars. But I won't believe it. And if I go back to Nigeria, go to all these herbalists, they will use all these their leaves and everything, and with the one that I drink inside, everything will go back. And when I come back to UK, and I will tell my doctor, look at everything has gone. I don't have it again. Before 1 month, before 3 months or 6 months again, it will break, it will open again. So I did it up to 3 years. And now other doctors now tell me I should stop traveling every year for this leg ulcer. This is what is peculiar to seculars.
It is
Regular
a
ulcer.
complication. Okay. It is a complication of sickle cell. There's something you are doing in this country which is predisposing you to that sickle cell, to that chronic leg ulcer. Either you are sitting for too long or you are not taking enough fluid. You know, this environment Nigeria is more humid. It's drier here. You need more fluid than you do in Nigeria. Either you are not taking enough fluid, or you are not ambulating well, or you are not lifting up your legs when you are sitting on the computer for long hours. There's something you are doing in this country that is triggering that complication. It is a complication of sickle cell. But like our sister Chinoye said, you have to know yourself and you have to avoid triggers. You have to study yourself and see what you are doing that is making it recur. And you remove that thing. If you don't remove that thing, if you treat it, whether it is in Nigeria or it is in anywhere that you get healing, if you do the thing that caused it, if you go back and do it again, it will recur. So you have to find out what you are doing that is making it come back. Either you are sitting, putting your legs down for too long and not allowing blood to return to the heart easily, or you are not exercising, mild exercise, move around, or you are not moving around, or you are not drinking enough water. Thank God in this country there is food. In Nigeria, we don't have free food. We don't have food bank. We don't have support. When you don't have food, you don't have food. Everything is cash and carry. Medicine, cash and carry. Food, cash and carry. So if you don't have money, you suffer. But in this country, we have support. We have a welfare system. There is NHS. There is a food bank. There is all these things that can support you. So you shouldn't be having leg ulcer in the UK. There's something that you are doing that is bringing it. You must stop doing that thing so that it will not come again. It's not going to Nigeria to treat it and come back and doing the same thing. It will break down again.
I'm
Do you
going.
understand, my
Sorry.
brother?
Yeah. Sorry, doctor. I'm
Mhm.
working. I'm mobile. I'm always working. I go to work and I do all this support work, and support work. We move around with our clients.
Okay, okay. So when you
So
get home
I'm
and you want to sit down, put your legs on the stool when you sit down in
up.
the house. Don't hang it down. Put it on the stool so that the blood can flow back. Because when the blood is not flowing properly, that's when you have all this kind of blockage and it will lead to crisis.
Mm.
I hope you don't have
And
much crisis. Do you?
no, no, I don't have much crisis, doctor.
Except that recurrent leg ulcer.
Yeah, let's go, sir.
Always put your foot up when you sit down.
No,
And
doctor.
sometimes do leg massage.
Mm.
Drink water, put your foot up and do leg massage. So things will help because if the blood is not flowing well, that is when there's blockage. And that area that doesn't get poor circulation, the area that doesn't get enough blood breaks down and becomes a leg ulcer.
Mm.
Do you understand?
Thank you.
Yeah,
I
yeah,
wish you
doctor.
all the
Yeah,
best.
yeah. Thank you very
Thank you
much.
very
Mm.
much. Thank you. Thank you very much. Okay. I just want to say thank you to everyone that has come here tonight. Thank you so much. Hopefully, everyone has had their questions answered. I didn't want any kind of individual advice. Because obviously this is not a hospital, and because Dr. Ola also has not checked your file individually, so she's just giving her advice based on what you said to her. So I think it's very important that we know that. So I just want to say thank you so much, ma'am. Like literally
Thank you,
two
ma. Thank
minutes
you for
before the
coming.
meeting, and you have been so fantastic. I appreciate you, ma'am. Thank you. To everyone, to all the warriors, thank you so much. I see you. Seen a few of you online. I see you. You know, we acknowledge you and we love you. And like everyone has said, please, 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 I think the most important thing that has been said tonight is drink loads of water, know your triggers, make sure that you're not too hot or you're not too cold, move around in the plane, make sure that you're not doing all this mountain climbing and all of those. Try and avoid it. Please do donate blood, know your genotype, do not procreate if you have, you know,
Very important.
very, very important, please. And also support the people around you. That's also very key. Support the people around you. If you have a spouse, support them. If you have children, please do support them. If you have friends, in fact, if you have enemies, support them. If you have neighbors, support them. It's so important, honestly speaking, because I have seen people go through this pain. It is very painful. So please, thank you so much. And I appreciate you again. Have a very, very good weekend. Before we go, I'm just going to ask someone to quickly pray because I think it's important that we end in prayers. And maybe Dr. Ola, actually, please, ma, if you do the honors of just praying and everybody can then have a good night rest. Thank you.
Our Father in heaven, we thank you for this little
Thank
time
you.
of interaction and sharing knowledge with each other. We pray, O God, that as your word said in the book of Hosea 4:6, that my people perish for lack of knowledge. We have learned a little this evening. Help us to use it to make the life of warriors better in the name of Jesus. Grant us grace to be able to be supporters to them. We pray for those who have to live with this illness every day of their lives, that your grace will be available for them. None of them will go into depression. None of them will become weary. They will be encouraged. They will live a full life because, as our sister said, they are fearfully and wonderfully made, and God has a purpose for creating every life. Let each one of them find their purpose and achieve their purpose to the glory of your name in Jesus' name. As we go our separate ways, go with us. Keep us in your peace and in your love. In Jesus' name we have prayed. Amen.
Amen.
Amen. Amen.
Amen.
Thank you so
Amen.
much, everyone.
Thank
This
you
is
so
Pass
much,
the
ma.
Baton. If it's your first time here, we really appreciate you coming. If it's your second, your third, thank you for coming. We normally meet every last Friday of the month. We bring
Okay.
topics that are pertinent to us. If you want a topic to be aired or for us to look into it, you can email us at passthebaton@yahoo.com and we would look into it. We appreciate you. We say thank you. Also, there is our YouTube page is going to be sent out, and also the first timers link, I know it's somewhere within the chat missed. It will be sent out as well. If it's your first time, please do fill that in quickly so that it only takes a second. Please just make sure that you fill that in so that you can get future events. Thank you so much. We appreciate you again. If it's your first time, please do not log off. Make sure that you fill that form. We only use it to send you monthly email meetings. And we will see you next month in the month of September. Have a very blessed weekend and God bless you. Thank you. Thank you so much, Dr. Ola.
Thank you.
Thank you to my
Thank you,
guests.
Dr. Ola.
that you
Thanks for
here. We
coming.
appreciate
Thank
you.
you. Thank
Thank
you.
you.
Have a good night
Thank
rest,
you.
everyone, and bye-bye.
Bye-bye.
Thank you. Bye.